Hi, Dr. Michael Silverstein from Carnegie Women's Health. Let's talk a little bit about postpartum mood instability. Very, very common. Virtually every woman that has a baby, whether it's vaginal or cesarean, whether it's a short labor or a long labor, is going to come home with a whole new environment surrounding them. Quite often, this person's going to come home with a moderate amount of sleep deprivation and moderate amounts of discomfort. So it's a brand new environment for her. At least half of patients after they deliver, and in many studies it's even more than that, will have some amount of mood instability. That might manifest as breaking into tears for no apparent reason, and that might be immediately after hysterical laughing and being amused over the baby. And so that level of mood instability is often ameliorated by family support, getting adequate amounts of sleep, and trying to divide your time as best as possible between the child and your own recovery. Of those, the most important has to be adequate amounts of sleep. A significant majority of all your healing takes place while you're asleep, and a little bit less when you're awake. The average newborn sleeps between 14 and 18 hours in a 24-hour period, but very little bit of that is consecutive. However, if a woman needs 8 hours of sleep in a 24-hour period, that could be 16 30-minute naps. And the way you accomplish that sleep is by making sure that you nap when the baby naps. You have to be a really good napper. Very often we have this discussion with our patient in the third trimester. In the third trimester, a lot of women are awoken by needing to go to the bathroom, by aches and pains, by baby kicking, and we encourage them to also be frequent nappers because maintaining your energy for the last part of pregnancy is so important. So if you've gotten good at it in the third trimester, you really have to get good at it in the postpartum period. Screening for postpartum depression is another level up. So we screen at the postpartum visit, at the 6-week visit, but it's also important for your allied team, your partner, your family, to recognize that functionality is going to be the key to an early diagnosis of postpartum depression. If you're unable to care for yourself, if you're unable to extend care to your child, that's one of the signs that ought to be brought to the attention of your physician as early as possible, because that lack of functionality is a very, very strong indicator of postpartum depression. A significant majority of these patients will be assisted by medications that are perfectly safe to use during the recovery period. Many pediatricians allow breastfeeding on these medications, but it's also important to understand that most of these medications take anywhere between 2 and 3 weeks before they're effective. So if you conceal these symptoms, or if you don't address these symptoms in a proper amount of time, you can lose a lot of that bonding time with your child that, if it had been addressed earlier, could have happened a little bit sooner. And so sitting on these symptoms for 2 or 3 weeks, addressing them, and then starting a medication, it could be another 2 or 3 weeks before you're really at a functional level with your child. And so early approaching your obstetrician gynecologist is essential in these cases. In exceedingly rare cases, fewer than 1%, women become dangerous to themselves and dangerous to their child. And any efforts in that direction need to be addressed to the physician anytime, 24/7, because that's a serious concern for the entire family. So, in summary, mood instability, laughing, crying, being functional, getting adequate amounts of sleep, support by the family will get the vast majority of patients through this turbulent time in their life. Lack of functionality, inability to care for yourself or your child despite adequate sleep and family support, needs to be addressed with your physician. And again, in the exceedingly rare cases of being a threat to yourself or to your child or to somebody else, 24/7 needs to be addressed to a physician. And we at Carnegie Women's Health would enjoy being your physician and caring for you after you deliver.